Right on time. So, hello, and I would like to thank you for taking the time to join us on this second CLEAR Forum meeting. For a few of you, this is the first time attending, and we'd like to say hello. I'm going to turn the Zoom platform over right now to Mark Farfel, the director of the World Trade Center Health Registry, where he will give a brief intro and a recap of the last meeting.
Okay, so I too want to welcome everybody. It's really good to see you. This is the second CLEAR Forum meeting. And for those of you who don't remember what CLEAR stands for, I wanted to remind you that it's Cohort Longitudinal Engagement and Retention Forum. So we're very pleased. I think we have, all the cohorts back who were attended the first meeting, with the exception of one that Paul mentioned. Plus, we do have Terry Moffat joining for the first time from the New Zealand Dunedin cohort. And also, I know Royce from Flint, Michigan. Is there anyone else that's new?
Diane's new from our end.
And right, and Diane Brown from our end, from the World Trade Center Health Registry. Thank you. So here's my brief attempt to recap the first meeting. There was a lot of enthusiasm for continuing the CLEAR Forum so that we can share challenges and best practices. And despite recognizing the differences across our cohorts, we felt we had, a lot in common, and that we wanted to keep meeting perhaps every couple months to discuss ways to keep our cohorts engaged for the long term. And we're still confident we can all gain from sharing and discussing how we promote and approach our participant engagement and how we celebrate our milestones. Anyone like to add anything to that brief recap? Okay. If not, based on the suggestions that we got at the end of the first meeting, we picked today's topic, which is the methods of tracing and updating our cohort contact information. So Paul, would you like to get us started? Can't hear you, Paul.
Okay. Before we do that, and move on to the second event on the agenda, Terry Moffat from the Dunedin Multidisciplinary Health and Development Research Unit, who was not able to attend the previous CLEAR Forum, is going to give us a brief description of her group. Terry?
I see another young man joining us.
Yes.
I see a little man joining us. I don't think he heard us.
Great. Shall I begin? Okay.
Yes.
I'll be quite quick with this. So I'm here to represent the Dunedin Multidisciplinary Health and Development Study. It is a study that is located on the South Island of New Zealand in the city of Dunedin, a city of about 150,000 people. It began in 1972-73 as a perinatal cohort with all the babies born in one province in one calendar year. There were 1,037 of those babies were followed up at age 3, and that was the start of the longitudinal study. So the difference between the babies born and those followed up was that some babies were their parents moved away, they moved out of the province, some babies didn't make it and died, and some babies had been obstetric high-risk births who came from outside the province to the hospital for the birth event. But those who were still living in the province at age 3 and still alive ended up taking part. And they represented the full cohort that was born. We last saw them in 2019. There have been 14 follow-ups over the years. 94% of those still alive took part at that point. And ethnically, the cohort is 93% white European ancestry. It's a study of health and development, broadly construed, and that's why multidisciplinary is in the title. And another special thing about it is that all the data are collected in clinic So the study members come and spend a day and a half in our building, going from room to room, being assessed by technicians and nurses and professionals from the different disciplines. Let's see, is there anything else I should say about it? Oh, yes, Friday is our birthday. It will be 50 years since the first study member was born. And so there will be, inside New Zealand, there will be a big media blitz, and Television New Zealand is doing a story. And so Friday is a very big day there with a cake cutting at the university. And it'll be a big day here at Duke too. We're going to have a birthday party for the study. Thanks.
Thank you. And Duke might go all the way.
Yeah. We'll have another party next week
Right.
for the basketball team.
Yeah, thank you for mentioning, how you celebrate the milestones. And, I look forward to, hearing from you and the others how you all do that.
Okay. Now we'll move on to the second part on the agenda, and that's a presentation of the methods of tracing, updating contact info used by us here at the World Trade Center Health Registry, specifically by Felix Ortega. And he will take this over right now. I'm going to change the screen to represent Felix.
Thank you, Paul. So as Paul mentioned, I'm going to give a brief update on what we do here at the registry with regards to contact update. And next slide, please. One of our biggest challenge is that we have a fairly large cohort, and many of our individuals since the event have either moved outside of the New York City area or internationally. So it's a little bit tricky keeping track of where everybody goes and making sure they remain active. The registry participates in two types of tracing. We do passive tracing with the use of our materials that we send out. We send out an annual card every year, and newsletters, as well as an active website. With the annual cards, we currently, include a message for the enrollee to provide us with feedback if anything has changed. But we rely on the U.S. Postal System to send us back information from the national change of address, whether it is a new forwarding address that the person registered, or the undeliverables that come back, at which point they will end up in our tracing queue. The newsletters, again, we also have a reminder there for those who receive the newsletter to log into our website or contact us and provide us updates as they go along. The web update is something that's always active. Anytime the enrollee is able to log into our website and have a username and a password, they're able to get in and provide us with an addition, any updates that may have come during that time. For active way of tracing, we use a vendor and as well as in-house person power to lead on the tracing. Our main vendor is Acuren with their software LexisNexis. LexisNexis allows us there's a company that collects public records and compiles everything to provide individual records for individuals. So for them, they collect anything and everything from home purchases to the supermarket discount cards that you sign up for your discounts. So all that information goes somewhere, and they manage to just dig everything out and create a profile for every individual. And as they go along, as they find matches with the same individual, they maybe combine those profiles. This allows us to do updates to our mailing, phones, and in some cases emails. However, we are very careful not to do email updates on our end because as times have moved on, many of us I know have a particular email that we use for shopping and other junk information that we usually get. So we want to make sure that we don't overstep our boundaries in reaching out to our enrollees and get an idea and in that sense of when we reach out to them. Aside from this, aside from the vendor, as I mentioned, we do active tracing within the registry. I oversee a team of about 4 individuals who currently put in the time to reach out to the enrollees. And this involves phone calls directly to the enrollees, emails, and in some cases, calls to their secondary contact. In the enrollment process, the registry put in a feature that allows the enrollee to provide us with a secondary contact, someone who will always know if the person moved or they changed their phone number. It's a good reference for them. So if we after we exhaust all the mailings, phones, and emails directly to the enrollee, we take a step to reach out to that secondary contact to see if there's an update. This process of calling, emailing, and doing the tracing, it takes about, it takes between 3 months to sometimes over a year, in the, depending on the volume of enrollees that we have in the queue. Next slide, please. On our end, this is a quick snap of the tracing module that we have that we currently use. This is a sample of our in-house software called RTools. RTools is, I guess I mentioned, an in-house software that we developed to track everything that about the enrollees and every interaction that we have with them. This is a sample of the tracing module. Here you can see how we trace LexisNexis, the different rounds of tracing, including then phones and emails and secondary contacts. And then we reach the unreachable area. You can see here the information of how we keep names from the enrollees, their addresses, the different phone numbers, as mentioned in the outreach for phone calls. We may have 1 to 3 phone numbers for the individual. So we try to reach at least do 3 rounds of calls to each one of those numbers, again, over a period of a few weeks with some time in between the calls to make sure we're not stepping boundaries with respecting the boundaries of the enrollee's privacy. As you can see here as well, there's additional information regarding the enrollee with regards to other demographics that we collect: social security number, date of birth, the language, their gender, and as well as here we call the Lex ID, which is the ID that the vendor provides. It's a good way for us to reference past searches and future searches to make sure that we don't do the work more than repeatedly. We do go through rounds of tracing. So at each round, one of my staff members will look at it independently of another. This allows us the time to give fresh eyes to the search each time we do the search. Next slide, please. This is the windows, general windows that we use for within Accurint LexisNexis for tracing. The advanced person search allows us to search for the individual by any of these features: last name, first name, middle names, date of birth, social security numbers that we do have. We can specify a radius of the location of where maybe the address that we do have is. Sometimes the error could be something as simple as an apartment change. So it could be the same place, just an apartment change. Driver's licenses, all those features there listed. We could search for. We could even limit the age search. As I mentioned, when we do a search within LexisNexis, the software will give us anything that matches what we provided. So it could be something where like you have 2 matches or 1 match or 50 matches. Now, the job of the individual in this process is to narrow down and make sure that we match the record that we found in LexisNexis to the record on our registry. And again, we go through, there's a protocol that everyone follows to make sure that we get the right individual. Another feature within LexisNexis and tracing is the real-time phone search. This has been a game changer since they started using this. The real-time phones allows us to find active phone numbers that are available for the individual. So in the most cell phones are not listed, but if the individual our enrollee has a contract with a cell phone company, the contract will be listed here. So the address of which the billing is registered is something we could match to a address that we have, or maybe update our address to that. And all these searches and results are provided are all dated, noting the last active time within that was reported to LexisNexis. As I mentioned in the beginning, they collect all types of public data, and they chronologically listed to make sure that you know when was the last time that a particular address appeared for that individual. And lastly, within the searches of LexisNexis, we do have the option to look for relatives. So many times the enrollee may have a relative that moved with them, or someone who may be even listed as their secondary. So we're able to do that matching by selecting the relative tab here from LexisNexis. And that covers almost everything about our way of tracing. I guess I mentioned, like we focus on two ways. We passively just wait for something to happen for the enrollee, and provide for them to contact us directly and provide us feedback, or we do the active tracing. Again, with the another active way that we do the tracing is that the registry constantly has a project going on, including our treatment referral program, which we're constantly reaching out to enrollees about signing them up for the health program or other items as such. And that's always a chance for us to check the information that we do have, update it if necessary. By the same token, if the enrollee contacts us, trying to get information about either the health program or the Victims Compensation Fund, we always take the time to check to make sure that, number one, we're speaking with the enrollee and we are not providing information to someone else, but at the same time, update their contact information to make sure that we have the latest for them, and if needed, like a family member. A lot of our cohort is linked to other family members, either a parent or a spouse that may have experienced the same at the event, same time.
Felix, I noticed we have a question from Brenda.
I saw something pop up in the chat.
If you get the
let me
name of
see.
the contract, for example, Verizon, how can you get the cell phone number? I was not aware that you could. So
we don't get the company that issues the cell phone number. What the system provides us back is a so let's say we search for the standard name of Joe Smith, and we see that John Smith, the real-time phone features available. We select that. It would show us what phone numbers may be associated with John Smith. So if John Smith has a contract with Verizon at 123 Main Street as the listed address, that's what it would tell us, that phone number, let's say was the billing was paid this past March. So it shows that, yes, there was an active feature, an activity on that phone number and the billing, and showing the date and letting us know that it's a valid number and that it's registered at that address. The question from Roy Stevens regarding the reliability. It's as reliable as public records data could be. Some things change today. They try to maintain it active and follow up as data is collected. Sometimes you see change that happen after. You can see changes 2 weeks. Sometimes it's been a year since they update the record, but the person maybe told us that they moved over a year ago. So it all depends on when it's registered. Again, it's public data that what they do for us is basically compile all the data and allows us to do the search for our enrollees directly to matching.
So Felix, two other questions just popped up. The pricing for LexisNexis and how the real-time phone feature, how new is that?
So it's not cheap. We do purchase. We have a purchase set of about 7 licenses for our group and our tracing. I think that comes to around, remember correctly, it's about $1,300 a month for all the licenses that we have in place and all the features that allow us. Some features are unlimited searching. The company could, you could generate the contract based on your needs. So certain features such as the search for email, so search for the phones, maybe something you could pay per use or have a general contract that allows multi-use. And the question regarding the real-time phone feature, it's been around for a little while. And I know that they constantly make updates to different features. One thing that I was informed by them is that the relative feature right now is going to soon it will start providing us with actual detail of how the person's related to an enrollee. Right now, it will just list you, if we select Joe Smith and we select the relatives, it'll say, Jenny, Mike, and whoever they may have, the record may be able to match them with. Maybe they were all listed at the same address for a certain amount of time, or something else that kind of groups them together. By saying something else that may group them together, but it doesn't tell you exactly their relation. The way to kind of find the relation, and this is where the person doing the search does the digging, is that you look at the age groups, look at the age of the relatives provided, compared to the age of the enrollee, and see, maybe try to guess what their relation may be, maybe parent, maybe a sibling. So you try to match that. Unfortunately, as far as we know, it's something that it's only offered for the US only. Internationally, not aware that they have provided those services. I could ask. I know that definitely is US based, but I could be wrong. It could be, they could, something that we could ask them a question next time I meet up with them. Is it possible to get mobile phone numbers because it's being so yeah, so it's the way that, I'm sorry.
Well, there's actually one question before that about, has there ever been an issue with IRB using LexisNexis?
So we do have a memorandum of understanding with the LexisNexis, and that's clear by our IRB, and there's strict guidelines as to how the information that we use, that we provide them on our searches is safeguard, as then the same way. The same way for us. There are certain names that will throw up a red flag. So I'm immediately contacted if one of my staff members searches for a private public figure, let's say, and information gets flagged, and I'm told, like, well, this is blocked for certain reasons. Please make sure that this is not a search unless it's someone that's directly involved with your organization. That's not, you can't just start searching for where, your favorite movie star lives or anything like that. And to the last question regarding getting the annoying phone calls. So again, everything is public records. That's, whenever we get a new phone number or a mailing address, and our enrollees may question.
You also mentioned using, because you've worked on a lot of emergencies through the New York City Department of Health and Mental Hygiene, that different programs use different ways of accessing and doing searches, one of which is medical records. And so what else?
Well, if you don't mind if I
So-
jump in, Lydia, real quick?
Please do, yes.
Yes, no, I think what the takeaway that for me was that most people were saying that they never had training to use LexisNexis where we had training, because we had the opportunity to have training with several employees for LexisNexis. They went through the process of showing us the best methods or the best ways to search, to find people, or to get information back, the most information back. And so what I would recommend, if your program is using this and you've never been trained how to use it, or no one ever showed you how to use it in a way that will be most effective, that you reach out to them, because it really makes a difference if they go through the steps and show you, techniques or what you can do or information that you can put in to get back as much as you can. So that's what I would recommend.
Okay, that sounds interesting. So let's move on to group 2. And that
Okay.
was Felicia Eschra, Doug Daniels, and Terry Moffett.
And I was moderating that group.
That's correct.
Yeah, just before I move on, just to add on, yes, Diane, the training from LexisNexis makes a huge impact, and we will be training again soon to make sure that we're up to date as well. And something that they recommended, it's if you do have the software with purchase the software from them, it's something that's open. You could always ask for additional training, or have their staff give a virtual training for you guys. So on my end, the team from my group, we went over and Felicia mentioned that they tried LexisNexis in the past, and maybe something that they take a second look at. On the World Trade Center Health Program, and Doug mentioned that for them, their enrollees are there's an incentive with regards to the claims and the services that the health program provides. So the loss of contact it's not as greatly as with other registries. Terry mentioned that unfortunately, vendors like LexisNexis are not out internationally, and the public records is it's maybe a little more limited, and also having with their cohort, one thing that was common in both in Terry's cohort as well as Doug's is that there's a constant tracing, and there's a constant contact with their enrollees, or the cohort, with regards to a yearly follow-up, and the use of a secondary contact, a family member who always knows where this individual is. So that's definitely useful, something that has been useful for them. Anything that I'm missing from what was mentioned? No. Yeah, the secondary contact is it's been big in all those groups.
Getting the letter at some point saying I'd like for each study participant to say I'd like to be found and offered an opportunity to take part again. So please help find me.
Yep.
And you can use that, for anyone who has reservations about sharing information.
Thank you. Okay, group 1.
Okay, then we go to group 1, which was Gary
Okay,
Chase,
well,
Nicole Jones, Brenda Eskenazi, Emma Bucciarini, headed up by Mark.
Okay, there was so much said at this group. I had trouble keeping up in writing. So no particular order, but the just building on what Felix said, using Brenda mentioned interpersonal, communications, and getting best way of finding people is to get a lot of like secondary contact information on people right at the outset. Because she has very, undocumented workers, and they want to stay below the radar, and also very mobile. So that point came out. Issues came up about cost, specifically cost of something like LexisNexis, and grant funded programs just don't have as much resources as the World Trade Center Health Registry. Reaching young adults and wondering about the impact of COVID on all of this, keeping up with people right now. But Nicole mentioned that they're at the beginning stages of tracing, and they use LexisNexis for a bit, but not really successfully. And their staff did a comparison of other vendors, and they've come upon venverified.com that they're considering, because they also have a very mobile population. Maybe they can share their comparisons with the group. And Gary mentioned they're actually not using LexisNexis, but something called MicroBolt, was it? Credit Commander. And it has a people search function. It's connected to the credit system, and you can search by name, address, social security number. There's a flat fee per month of $130. And then after a minimum, I think there's a lookup of $1.30 per. And it's not a keen tool for keeping up with mortality in the cohort. And Gary also mentioned a free tool called Fast People Search, names, addresses, phone numbers. Sometimes it takes you to a point where you do have to pay, but it has age and it is accurate. And there's a lot of old data that's retained in that system. So we heard about other things that are being used. And Emma said, with the World Trade Center Health Program, it's a clinical cohort, so people really do need to keep up to date. And they need it's challenging to engage the young adults or people who are healthy to come in for their monitoring when they need that. So it seems like there's people are searching for tools and have found things that work that that they can afford with their budgets.
Gary actually listed the 3 in the chat section, so I will send those out to everybody. But if you want to look at it right now, he listed the other 3, and in addition to LexisNexis. Thank you for that, Gary.
And I had one more point actually from our group that was kind of raised. Brenda mentioned how fatiguing it is to be a member of a cohort and longitudinal study, and what it feels like from the other side for participants. I think that was just a really interesting point to bring up for us to think about what people are experiencing as they're hearing from us, and how challenging it is to be part of our projects.
Yeah. Thank you for mentioning
Yeah.
that, Nicole. That's one of the reasons why I think why we lose contact at times, because we don't want to interact as often with our enrollees or our groups. I mean, we want to definitely be in touch with them, follow up on what's happening, but we don't want them to, every time they open up a mailing from us, say like, oh no, not another survey. It's hard to find that balance.
But if I could just add something to that, or maybe think of ways that you can provide something back to them rather than something that they're giving to you. So for example, I mean, it's simple for us from when they come in, we give them a quesadilla, which they love because they're also hungry. But also we become almost a social service agency. We try not to be, because obviously we're not trained to be, but we provide resources. Like if someone has mental health issues or loses their housing, they know that they can come to us and we'll give them a list or contacts of who they can go to.
Yeah. Hi, Brenda. It's a really good point. One of the things that we do every year is we send out our holiday card. And I think Felix had a picture of it when he did his presentation. And you'll be surprised how many people will either call or respond back and say, thank you for that card. It meant a lot to me to receive that. But Lydia, who is in charge of her unit, TRP, the treatment referral program, excuse me for the acronyms, she does resource, she gives a lot of information about resources, and she spends many hours giving out information where people can go to find, and sometimes she is also a social worker, so she spent a lot of time doing that as well. So yes, we do try to give as much as we can, you know, because we do ask a lot. I agree.
And we are helping our enrollees with the process of applying to the World Trade Center Health Program. So they are usually very appreciative.
And the victim compensation fund too, Lydia, let's not forget.
That's right.
We have incentives. We have
Yeah.
incentives for them.
Also, Felix, you can mention on this screen that we actually have that distress level.
Yeah, so what Paul's pointing out too is our tools and what we developed for in-house managing of our enrollees and their contact information. We keep track of every interaction that we have with the enrollees. So I could see anyone that Lydia may have contacted to do a follow-up with an application for the health program, or we have notes as to every time we send them a letter, every time we send them an email, everything is noted, and having that history allows us to build and be able to relate to the individual every time they contact us or we contact them. What Paul mentioned about the distress level, there are times when, you know, someone may reach out and it's a different level of need for the individual. So when the record comes up, the person interacting with the enrollee or the registrant on the phone, like knows exactly, okay, well, there was an event at some point that maybe delicate, and how they approach the call, and you know, definitely make a point to go through the notes and see what extra help may be needed and what extra assistance may be available now that maybe wasn't available when this event happened. So that's thanks for pointing out that out, Paul. Other features from our tool are not listed here. I just took a small piece of it, but Diane and Lydia could attest to, like, you know, this has been a great way for us to manage all the small projects that we do in-house. You know, we're able to do sample selection and just track information on a couple thousand people and interact with them for a particular project, but also have that still be part of the overall registry database and how we manage all the contact information, as well as the record of the individual.
Okay, we are at the 1 hour mark, but if we could just stick around for a few more minutes, Mark can kind of wrap this up and talk about maybe what we would like to do going forward.
Okay, so, you know, it sounds like we just have a need to continue to share information on how we're tracing and some of these information sources we're using. So Paul set up the Google platform, and that's one way to post the information so we can share it, or you know, share it directly with Paul so we can send it if there's an interest there. I did want to see if we had any suggestions for a follow-on for our next meeting. Do you want to continue talking about this topic? We can certainly have presentations from the other cohorts as well. It doesn't have to be registry. Does anybody want to pitch out an idea?
So Terry might be interested in this, because we have some of our participants that have relocated internationally, and we have a couple of challenges with the mail, we've been doing remote visits, and we have trouble with Wi-Fi, we have trouble with cellular service, and there's so many limitations with what we just are hitting a wall with the resources that you have when you're in the United States versus out. It's really, really challenging, even with the best of efforts. I don't even know if it's solvable, but we really are struggling with trying to and we are trying to be equitable with how we approach things, and we have discrepancies because a lot of these in our minority population, and it doesn't look good because it looks as if we're not doing the same outreach, but in fact we're just hitting obstacles that we're not able to reconcile.
Yeah.
And that's even in the United States too.
Yeah. So So am I hearing a suggestion? Maybe we want to focus in on how we're handling, you know, certain hard to reach populations within our cohorts as a future topic. Okay.
I'll send that out in the Google Docs and maybe people can expand on that. Just one line or two, and maybe then from there we can formulate what the next topic could be.
Okay. And I just wanted to throw out another question for the group. You don't have to answer now, but just, you know, does anyone have a suggestion or want us to consider adding any other longitudinal cohort studies to the group? So please feel free to do that. And if we have a minute before we end, I actually have one request. I have a question for all of you. The registry is working on a manuscript with some of our NIOSH colleagues who are here today, Rob Daniels and Emma, on the scientific value of the child subcohort in our registry. Just sort of taking a look back, and we would like to be able to compare the enrollment rate in the registry overall and among our child subcohort as well to other longitudinal studies. So, and by the enrollment rate, I mean the proportion of the eligible target population that you actually have in your cohorts. So if any of you have that kind of information to share, we'd appreciate it, so that we can make some comparisons. And you can send that in an email to Paul. And also just wanted to ask if there are any final questions or comments before we end the meeting. Okay, so we'll be in touch as we were last time to schedule the next meeting. You know, in the meantime, feel free to email Paul, use the shared Google platform for sharing information in between meetings. And good to see you all again, and good to see some new faces. And thank you so much.
Thank you very, very much.
Okay,
Thank you.
see you.
Bye.
Bye, everybody.
Bye.
Thanks.